Hello and welcome to Shoulder Injuries, Prevention and Treatment Strategies Part 1. We're going to go ahead and get our medical disclaimer out of the way here. If you are having any shoulder pain problems, you should consult a doctor, and this information is just for your informational purposes. Okay, so our clinic's located in Palo Alto, California, heart of Silicon Valley, and I've lived and worked in a lot of places, and I've never seen such high incidences of shoulder injuries, and it's no surprise. Why is this the case? It's simply, the careers in this area are very high-tech, dense, and a lot of people spend time on the keyboard developing poor posture, which is going to subject them to the most common injury that you'll see is a shoulder impingement injury. So let's go over that, as most people, if they have shoulder pain problems, most likely going to deal with that more than any other injury of the shoulder. So you have, I'm going to spare you the medical jargon and anatomy terms, and we're going to call the bony prominence on the top here just the collarbone, and at the bottom of the arrow, you see that arrow arising up out of the bone there. That's the top of the arm bone, and that's a ball and socket right there. And those two bony structures, when they collide together, the rotator cuff muscles, as you can see now, are in between them, and they get sandwiched or bumped, and so you can get a rotator cuff tear, or basically an impingement where you're bumping those two bones against the muscle there. So that's, again, most common, and poor posture, of course, has a big cause in these impingements. So let's take a look at it. Most commonly, we're going to see a gorilla type posture here. We're going to see a pelvis that is slightly tilt back, and you can identify it on the lower body because the shorts will often spill out in front. And the chest and shoulder will become short. That's going to round the arms, and the head is going to go forward. So that's known as forward head posture. Upper cross syndrome is the medical term, but really, for all intensive purposes, it's kind of a gorilla posture that you want to stay away from. And I chose this bodybuilder not because he's asymmetrical, but what people work too much in the gym that can kind of create that gorilla posture is an overemphasis of the rectus abdominis. You see people just doing sit-ups all day long. That's really not good for your posture. And the oblique muscles as well. Doing too many cross crunches on the floor, those types of things. It's a great way to head towards upper cross syndrome. If you work the chest too much, you can kind of see how the fibers, how they attach to the shoulder and arm and internally rotate it. So again, front of the shoulders, chest, abdominals are overworked in relation to the muscles in the back of the body that will, of course, pull the posture back into alignment. Here's another same gorilla posture, but the difference that you'll notice is that this guy has forward head and rounded shoulders, just like the other guy, but the pelvis, instead of tilted neutral or back, is tilted downward. All right, and often the knee extends. So I don't want to get too much into the lower body, but I basically want to point out to you that these two postures both create that upper cross syndrome, that gorilla posture. So you don't want that. Yeah, so this guy right here, that tilting down of the pelvis, is going to create an extension in the knee eventually. He doesn't have it right now, but you can really classically see it in dancers, gymnasts that have that pelvic tilt, because again, that knee will extend, and that goes kind of beyond the topic of the video, but it is important to consider the ramifications of poor upper body posture, as it will also contribute to the lower body and cause some other problems down there that you don't want. Alright, so when you're dealing with shoulder issues and you've got pain there, sometimes it's hard to tell where the pain is coming from. Especially when you have something like the neck that shares a lot of the same nerve pathways into the shoulder. A good physical therapist or doctor will help you rule out potentially having some issues in the neck that actually could be what's called referring pain to the shoulder. So it's not actually a shoulder problem that's causing, but it's a neck problem causing the pain in the shoulder. So that's an important consideration. Plus the neck and the posture in the head and neck does have its influence on shoulder mechanics. Thoracic spine and shoulder pain. Alright, so most of these people coming into clinic here that have shoulder problems are going to have thoracic spine problems. If you look at the purple there, the T1 through T12, basically the majority of what makes up the spine there, that in a lot of people is dysfunctional, and I'm going to show you how it creates problems. Now, my posture is completely fine, but I'm exaggerating here. The image to the far left, I'm giving myself a hunch there in the upper back, and I'm actually extending my arm up and back as far as I can. So right there, that's as far as I can go with that posture. All right, in the middle, if I'm have good posture and I'm standing upright, my arm can go right up above, straight overhead. And then if I'm extending my whole spine and arching it back, I can even go beyond that point. Okay, so that just shows you that the shoulder is a slave to the upper back in terms of anything overhead. So your golfers, your tennis players, it's going to be real important for them to have a good range of motion in the spine, because if you don't, if you look back on the left and I'm trying to swing a tennis racket overhead, I'm going to try and reach back as hard as I can with the arm, and that's when you get into shoulder impingement problems, right? Because I'm forcing it to try and make up the difference of my thoracic spine there. So if you can't extend your upper back, flatten it out, reverse the spine angle, you're going to be in trouble. All right. Obviously, there's genetic reasons. This gentleman here on the left, congenital problems at birth. Okay, that's going to be rare. And then poor posture acquired. This is going to be more typical, of course, of your your worker that has poor posture on the keyboard, right? Or they're just working out improperly. They're doing too much chest, biceps, and ab crunches, and they're not doing the muscles in the back. Okay. Okay, before we get going on the corrective exercise section, there's one more thing worth mentioning, and that is the lats, or the latissimus dorsi there on the left-hand side. You'll see that big, large back muscle. It tends, in those that have shoulder injuries, it tends to be overworked relative to the rhomboids muscle groups, which are in the upper right here that you've seen highlighted there in those red little strips. So I automatically pretty much assume there's that relative weakness because, like I said, it pretty much is the case for every individual. And to pull the posture back, you will need to do more work in the rhomboids relative to the lat, because the lat rotates the arm inward, and the rhomboids will help position the shoulder blade backwards, and that's really what you want more of. So without further ado, here's a list here just for your reference. I'm basically grouping them together, basic to more advanced. And so when you start your posture work, you'll really want to focus in on the rhomboids again, and you also want to select the easiest grip to position the scapula correctly, which is going to be a supine grip, which basically means like you're holding a cup of soup. You're going to have your palm facing up when you're pulling something inward. And this is probably one of the most basic forms of a row, and you can see that palm is facing up there. That's a great way to work the entire posterior muscles of the body, and especially those rhomboids. And it's always easier to start off single arm at a time so you can kind of control it. After a while, you're going to be experimenting with some double arm action movements, which require a little bit more coordination. You can also use a barbell. You'll basically want to vary the pull types and not stick in any one pattern for too long, because each grip and each pull pattern has its own benefits. Rear deltoid and rhomboids. I really like this one. You can take an incline bench or a bench that has adjustable inclines to it. I like about a 15-degree bench on the incline, and you're pretty much having that long lever arm out in front of the body, very slight bend in the elbow. Basically, arms are straight at the end, and you'll want to have the arms extend down and back. You don't want to have create a 90-degree angle there. It's about a 65-degree angle or so. It's kind of hard to tell for that picture. The real delt machines, kind of similar in terms of the overall motion. It is more of a 90-degree, and you'll simply see these in health clubs. You'll face inward, the arms adjust all the way in, and you're going to be pulling the arms out to work the back of the body, the shoulders, the rhomboids. Okay, so again, it's best to start out with single arm as far as coordination and really getting each side individually to recruit the way you want to. So here you have a cable machine and one of those little handles to extend the arm down towards the body. I stop usually on the quad or no more than the hip, and the arm is held out in front of the body the whole time. An easy bar press down, again, that's just a 2-arm version. Now we're getting into some of the scapular depressors and abductors, some of the smaller rotator cuff muscles, which are really important to work. And here you isolating one of the rotator cuff muscles called the infraspinatus. The other ones help stabilize it, of course. But what you're going to do is select a very light weight. I have a 4-pound weight, but probably with shoulder injuries, we have a lot of people start off with a half a pound or even a quarter pound, or just arm weight even. And you'll need some kind of cushion or towel. Roll up a shirt, roll up a towel, and you want to keep the arm in line with the spine angle, in line with the body. You'll see a better picture of off on the right there. You're going to keep about 30% pressure or so down onto the towel, and that will help stabilize the shoulder joint as it rotates. Very important there. And as I'm going through this, in terms of reps, sets, and all that kind of stuff, it's really too difficult for the purposes of this video to go into program design, and that's all individualized, especially when you're talking about shoulder injuries and treatments. So standing internal rotator, we just saw the previous picture, external rotation. Now you're going to be holding the same technique, holding that towel about 30% pressure inward towards the rib cage there, and you're going to be rotating now from out into the midline of the body. So you're going to be lining that hand up about with the belly button there. Dumbbell protractions. This is best done. You could do it on a floor, but best done on a bench. And you're going to be holding again lighter dumbbells, not as light as the rotator cuff, but still pretty light. And you'll be protracting your shoulders up off of the bench. So actually, it's hard to see because it's black on black there, but I am elevating the shoulders, so the shoulder blades themselves are going outside, towards the outside, and lifting up off of the bench. Feel free to, at the end of this video, I leave a list of resources. Some are videos, some are articles that have pictures in them, so you can get a better idea, on video or in movement of some of these shoulder exercises. And you can consult our YouTube account it's called Silicon Valley Fit on our YouTube. All right. So now this is great exercise because you can use it pretty much anywhere. I learned it from Tom House, which is a authority in terms of keeping professional baseball pitchers injury free. And so it's a really good series. And what you'll do here, as this is done standing, always have a slight bend in the knee when you stand, by the way. So you have your base, and you're going to be pressing with your palms on the the top of the sacrum, the butt there, into the body for 5 seconds. And you'll see how my shoulder blades on the left hand side are kind of just sitting apart. Then what I'll do is I'll squeeze them all the way together for 5 repetitions. So I'm actually doing full scapular contractions. Again, consult those videos if you need more of a visual on that. And you're alternating between 5-second holds and 5-second retractions for about 5 sets. All right. Then you're going to be turning your hands down the other way and performing the same technique. So you're going to be repeating that. Then you're going to be back to palms toward the body, pressing inward, but they're going to be crossed over. And simply do the same thing on the other side and cross over and switch. This one is pretend like you're pulling your hands apart, not necessarily as hard as you can, but pretty good firm pull pressure. And as you do that, you'll be retracting one shoulder blade. In this case, off on the right, I'm pulling the shoulder blade down and back on the right as I go, twisting the upper body, and the lower body is staying still. Okay. And I've just drawn the lines here to show you the difference between the scapula at rest and the scapula retracted all the way towards the center. You see how those lines come together. Okay. So I'm just cycling through the rest of those. Okay. These are a little bit more advanced. Some of the motions you'll be familiar with. They'll look exactly the same. But we're now going to use a pronated grip, and it is advanced. You will not be able to, most people cannot lift pronated as much as they can with the palms up. Part of the reason is your ability to control the shoulder blade, okay, and activate the bicep. So this, you're going to have to reduce your weight by about 20% on the rows. It's a little bit different for everybody, but you just basically reduce the amount of weight that you're accustomed to when you transit to this grip. All right, so again, nothing really changes. It's just the hand grip. The arm does move out from the body a little bit. It's hard to tell from that picture, but same thing. You apply 2-arm action versions as well as using a barbell. Okay, and also on your pullbacks, you can rotate those palms down. Same thing on the rear delt. You can rotate them. I actually have them in neutral grip, so the picture's off on this slide. I apologize, but you'll actually want to turn those palms down. Easy bar press down. Now to make it more challenging, you're just simply, if you look at the picture off to the left, I've increased the motion. Remember, we started out parallel to the floor, so you can control that scapula a bit better. Now you're going to allow the arms to move up to eye level or greater as you control that scapula. Okay, more advanced version of those isolated external rotator cuff exercises. Here's what we're going to do. We're actually going to put the leg now out in front of the body so you get that torso lean forward. That's going to make it much more difficult on that rotator. I would do a set of 10 repetitions in that direction, and then you're going to transition directly into the neutral one you see right in the middle. Do another 10 repetitions, and now you're going to be pretty tired, so now you're going to lean back the other way. It will be easier than the other two, and that's okay because you're going to be tired as you're moving up towards 30 reps or so. Okay, more advanced exercises for the scapula. Remember, we had the protractions on the flat bench. Now we're in a push-up position, and you're protracting the shoulders, kind of like a punch off of the floor. So again, very little movement, but this is much harder than controlling it on the bench. And start to exercise the external rotator cuffs in the more advanced positions. It's oftentimes that baseball pitchers, when they first get injured in a rotator cuff, muscle group, they'll start with those therapy exercises on the floor, and then they'll gradually move up to more advancements. And this is, you can kind of see as you're standing up, it's more closer to the functionality of what they would do throwing a baseball. And then, of course, you go back to pitching baseballs. So that's the end of part 1. There's going to be 3 parts in the series, and feel free to access your resources here. We have a bunch of shoulder-related articles and videos. You can visit our website and surf around. I have given you the direct links, though, for a variety of topics in and around the shoulder. So you can feel free to click on those. And we also had one more article there that's related. Also, I wanted to include this as a resource. This is an excellent book, and if those of you who are injured and have trigger points, it's good to understand what they are. It's basically knots in the muscles, but the physiology is very important to understand, and you can also help your therapist along and do some self-work and self-tissue relief. So I highly recommend that book. And for those of you who have any questions over this video, feel free to call us at 650-858-1213. Again, that's 650-858-1213. Or you can email us at info@siliconvalleyfit.com. That's info@siliconvalleyfit.com. And I hope you enjoyed the video, and we will be posting our other versions of the series 2 and 3 relatively shortly. Thank you.